ADAA educational webinar, and we will be talking today about healing invisible wounds and PTSD and the national challenge that we're experiencing. We are lucky and we feel really honored to have with us today U.S. Army Lieutenant General Burt Garrett. Burt Garrett is a retired U.S. Army Lieutenant General serving as executive advisor to Emory's healthcare system, healthcare veterans program in Atlanta, Georgia. The Emory Healthcare Veterans Program is a national leader in healing invisible wounds through innovative clinical care, research, and education. In collaboration with the Wounded Warrior Project, the experts at Emory treat eligible post-911 veterans and service members regardless of location, discharge status, deployment history, or length of service. And I am Dr. Deborah Kissin. I am the co-chair of the Anxiety Depression Association of America, ADAA's Public Education Committee. And we have with us today one of our wonderful therapists at the Light on Anxiety Treatment Center who works with me, and she's a committee member of the ADAA Professional Education Committee, Cordelia Grimes. And I just want to tell you a tiny bit about ADAA's resources that you might find helpful as you're listening to this webinar and moving forward. So there's a really great Find a Therapist resource on the website, adaa.org, and you could find recommended providers to treat anxiety, depression related disorders. There's also free online anxiety and depression and peer-to-peer support groups, and tons of really good information. The challenge these days is there's so much information out there, but how do we separate out what's high quality and what's going to get us moving towards healing versus might just be overwhelming and not even accurate. So this webinar that we are doing today is along that cause of trying to really enhance the dissemination of high quality information. So just jumping into the presentation today, I'd like to start with just kind of throwing out here to Burt, if there's anything in particular that you would like to share with us today about PTSD.
Yeah, Dr. Kissin, thanks to you, Cordelia, thanks to you for joining us. Thanks to ADAA for hosting this and for everything that the organization does on a day-to-day basis. I was very impressed when I went to your website and saw the number of people that connect with ADAA globally to look at your resources. Very impressive. It numbers in the high millions, so that's very impressive.
Yeah.
And again, it's a great honor for me to be here, and I'm very grateful for ADAA's sponsorship of this forum. What I'd like to do today with you is to talk about healing invisible wounds, and with a focus on healing our service members and veterans with post-traumatic stress disorder. And an upfront disclaimer, I'm not a doctor, and what I'm talking about is not professional medical advice. So Dr. Kissin will rely on you and Cordelia for that as we move through the discussion.
That sounds great.
Yep.
So tell us that we've all heard about PTSD, post-traumatic stress disorder. I'm sure a lot of our viewers today hear about it in the news, wondering, is that something that makes sense for me? Can you tell us a little bit about PTSD, post-traumatic stress disorder, and some of the symptoms of PTSD?
Sure. PTSD is a disorder in which a person has difficulty recovering after experiencing or witnessing a life-threatening event like combat, a natural disaster, a car accident, or sexual assault. Its evolution, human beings are hardwired to remember life-threatening memories for our long-term survival. And if a tiger came out of a cave, and chased us and we survived, we would never forget that cave, right? So an abnormal reaction to a traumatic event is just normal behavior. But most people start to feel better, after a few weeks or months. If it's been longer than a few months and you're still having symptoms, you may have PTSD. And for some people, PTSD symptoms may start late, or they may come and go over time.
In question, slightly off script, but just something I'm curious about as you're speaking. some individuals may experience the same traumatic event. Some go on to develop PTSD while others may not develop PTSD. So is there any research or anything that you've learned through the work that you've done in terms of what may increase the likelihood of developing PTSD from the same experience that different people might have?
Yeah, and I think to your point, studying soldiers in combat today is a great way to understand that, because every soldier, sailor, Marine, every service member is different, and they're put into an environment that is different. For some of them, they may see traumatic events literally every other day, or every day in some cases. And their reaction to that may vary from some of the symptoms we'll talk about later to absolutely no reaction at the moment or shortly thereafter. But maybe when they're back in the States, they begin having a challenge with that. So I think it varies on the person, the situation, and then frankly, there's got to be something in the personality, the DNA makeup of the person, because people react differently, and the same person can have a different reaction based on a different day, different event. So I hate to sound fuzzy about it, but I'm not sure that there's research that can answer that very question.
Right. And that's good for our viewers to understand that it is that combination of the trauma, the biology, the history. And so none of us can make any assumptions about how really we're going to manage and heal from situations. We kind of have to wait and see.
Yeah, and for our
how it goes.
That's right.
Yeah.
And for our service members, they need to understand that this goes all the way back into history, literally from the beginning of conflict to now. People have been dealing with PTSD. It's been called different things. I think it hit the DSM back in the 90s, maybe, as an official diagnosis, but it goes back into antiquity, and we have to understand that. So it's been part of the human condition all of those years. It's just in the kind of the post 9/11 era, we began to understand it better, and certainly to treat it in a much more effective way.
Cordelia, do you have a question for Burke?
Yeah, I mean, I absolutely agree that it's a very important issue to continue to address for the military population. Is it what are your thoughts on PTSD outside of the military population? Is this just a military challenge?
Yeah. So the question really is, who develops PTSD, and is it just a military challenge? And I think certainly our service members face increased risk of exposure to traumatic events, and thus they're at higher risk of PTSD. But the medical community now recognizes that PTSD affects civilians and soldiers alike. In fact, anyone can develop PTSD at any age, and a number of factors can increase the chance that someone will have PTSD. And we talked about some of those earlier, but many of those are not even under that person's control. For example, having a very intense or long-lasting traumatic event or getting injured during the event can make it more likely that a person will develop PTSD. For example, a soldier, when he or she might get injured in a firefight, if they're wounded, that could increase the potential for developing PTSD. And PTSD is also more common after certain types of other trauma, to include sexual assault. And then, as Dr. Kissen mentioned earlier, there are personal factors like previous traumatic exposure, age, gender, things like that, that can affect whether or not a person will develop PTSD. So what happens, I might add, what happens after the traumatic event is also important. And stress, like we're seeing right now in the COVID-19 epidemic or pandemic, can make PTSD more likely, while social support, I guess is the best way to term that, can make it less likely.
Can you share with us kind of a quick and dirty list of top symptoms if someone's trying to figure out is this starting to fit criteria for PTSD versus standard healing or?
Sure.
Yeah.
Yeah. So PTSD symptoms usually start soon after the traumatic event, but they may not appear until months or years later. They can come and go, and we've got Vietnam era veterans, combat veterans, who are experiencing PTSD symptoms more than 50 years after their exposure to trauma in the war in Vietnam. And I would say, big picture, there are about 4 major types of PTSD symptoms, but again, they may not be the same for exactly the same for everyone. Let me run through those with you very quickly. First symptom is reliving the event, and that's typically re-experiencing some of your symptoms. And memories of the traumatic event can come back at any time. You may feel the same fear, the same horror you did when the event took place. For example, you may have nightmares. You may feel like you are going through the event again. It's called a flashback, obviously. You may see, hear, or smell something that causes you to relive the event. This is called a trigger, and news reports, seeing an accident or hearing a car backfire, those are good examples of a trigger event. Another symptom, it's very common, is avoidance. And just like the label describes, you may try to avoid situations or people that trigger memories of that trauma. You may even avoid thinking or talking about it. For example, you may avoid crowds because they feel dangerous. You may avoid driving if you were in a car accident or your military convoy was attacked. You may keep very busy or avoid seeking help because it keeps you from having to think or talk about the event. And I guess the third symptom is negative changes in your beliefs and feelings. And this one is especially problematic. The way you think about yourself and others changes because of the trauma. And this symptom has many aspects. For example, you may not have positive or loving feelings toward other people, and you may stay away from relationships. You may forget about parts of the traumatic event, or you may not be able to talk about them. You may think the world is completely dangerous and no one can be trusted. That's pretty common. A fourth symptom is feeling keyed up. That's called hyperarousal. You can be very jittery. You can be always alert and on the lookout for danger. You might suddenly become angry or irritable. This is known as hyperarousal. Some examples, you may have a hard time sleeping. You may have trouble concentrating. You may be startled by a loud noise or surprise. You might want to have your back to a wall in a restaurant or a waiting room. I guess the point is, it's important to remember when you look at these 4 symptoms that each person will experience those symptoms in their own way. So you have to be very careful you don't go into it with a bias. And as you diagnose yourself or others, you have to make sure you're thinking about these 4 symptoms in the right way.
Can you tell us about the treatment for PTSD and in terms of what are different recommended treatment modalities and how to access this treatment? But I guess just starting with, how does one move through and past PTSD?
Well, let me give you a little context for it on the front end if I can.
Please.
And I would say, if you look at the numbers, about 7 to 8% of the US population will have PTSD during their lives. That's not just veterans, but that's the
what
US
percentage
population.
did you say again?
About 7 to 8%.
Okay.
And about 8 million adults have PTSD during a given year. That's the US population. And then when you come down to the gender break, about 10 out of every 100 women, or about 10%, develop PTSD. And about 4 out of every 100 men, or about 4%, develop PTSD. So it's higher. It's almost double for women, believe it or not.
That is surprising. I was not aware of that statistic. Thank you for sharing that.
And then Within the US population, we have to think about the impact on our service members and veterans. And I would describe it, PTSD, as a national public health challenge that disproportionately affects those who served our nation. And as I mentioned earlier, military members face increased risk of exposure to traumatic events and thus are at a higher risk of PTSD. And I think the last figure I saw said about 11 to 20 out of every 100 veterans. Those are post 9/11 veterans, about 11 to 20 out of every 100. So that's 11 to 20% of that population of veterans who served in Iraq and Afghanistan will have PTSD in any given year. So it's a big challenge.
Is that increasing over time? Like individuals that were in the military 40 years ago versus now, or are you seeing increased, I don't know how much data we had in the past, but more rates of PTSD within the military over time?
Yeah, that's a great question, Dr. Kissen. I think it's a product of a couple of things. One is we have greater understanding of PTSD now. The military tracks it, the VA tracks it, so we're able to measure it, which is allowing us to understand the scope, scale, magnitude of the challenge.
And speaking of challenges of that, so what are some of the challenges to veterans or service members to getting treatment for PTSD?
Yeah, I would say there is a crisis of unmet need for post 9/11 veterans diagnosed with PTSD, and it centers around really three things. First is access, second is stigma, and the third is cost. And let me talk about access for a minute, because many non-military, non-veteran people don't understand this. The access is critical, and veterans face unique barriers to accessing adequate treatment. And these include the requirement that they have either an honorable or either an honorable or general discharge to access VA medical benefits for anything. So they've got to have the paper, is the term, the good paper that they need for that. There may be long waiting lists at the VA medical centers. Then there's geographic isolation because you don't have VA centers spread nationwide. I mean, they're spread nationwide, but the density is insufficient. So you have geographic isolation, people living far away from these centers. You have limited VA healthcare facilities where they may not be able to handle PTSD treatment. And most recently, you have a host of COVID-19 restrictions at VA medical facilities, just like you do at our other medical facilities. So access is a big, big challenge. Second is stigma. And as you all know, there is a stigma around mental illness in the United States. And the stigma associated with PTSD, I hate to say, is alive and well and is very strong. And stereotypes that depict veterans with PTSD as dangerous, unpredictable, or crazy can promote that stigma. And veterans with PTSD, they may feel embarrassment or shame as a result of that stigma. So that stigma can delay their treatment. And third, we talked about cost. So cost is not an independent variable. Veterans who seek treatment may incur significant costs. And you say, well, doesn't the VA cover that? Well, veterans have to take off time from work for their treatment. They have to obtain child care. They have to pay for transportation and lodging. They have to deal with medical insurance copays if they're outside the VA. So cost, again, we have to pay attention to that. That is a challenge for veterans. And one last challenge I'll mention is that 50%, that's one half, of 9/11 veterans, post 9/11 veterans, have no interaction with the VA at all. So we need a safety net for them too.
Yeah, so what are your thoughts on, the treatments for PTSD, and do certain veterans seek out alternative treatments because they don't have access to the VA? Or
Yeah, Cordelia, thank you for that. There is an alternative to treatment by the VA, and I want to highlight one today. It is the Wounded Warrior Project, some great folks down in headquartered in Jacksonville, Florida, phenomenal organization. They have partnered with 4 world-renowned academic medical centers to form the Warrior Care Network. Now, the Warrior Care Network puts veterans living with PTSD, traumatic brain injury, and related conditions on a path to long-term wellness. Participating veterans receive, I think, a year's worth of mental health care during about a 2 to 3 week intensive outpatient program. And it uses evidence-based treatments with alternative therapies. And I'm lucky to work with the amazing people at the Emory Healthcare Veterans Program. That's one of the 4 academic medical centers that comprise the Warrior Care Network. It's located right here in Atlanta, Georgia, headed up by Dr. Barbara Rothbaum, who's a well-known expert. Our deputy is Dr. Sheila Roush, who's also a well-known expert in treating PTSD and other invisible wounds. So it's my great pleasure to have a chance to work with these folks. It's about 50 doctors, clinicians, therapists who do nothing but take care of our service members and veterans and put them on a path to long-term wellness. So it's a great honor for me to be able to work with them.
And how does the program measure success? So what is a sign that one is moving through these invisible wounds?
Yeah.
Through and past.
So before I talk about how we measure success, Dr. Kissen, what I'd like to do is describe the program, if I can, for just a minute.
Please, yes.
The Emory program. So in a nutshell, the Emory Healthcare Veterans Program is a national leader in healing invisible wounds. And we do that through innovative clinical care, research, and education. And conditions treated include not just PTSD, but traumatic brain injury, depression, anxiety, and other conditions stemming from military sexual trauma. And I'm happy to report that the program treats eligible post 9/11 veterans and service members regardless of location, discharge status, deployment history, or length of service. The Emory's 2-week intensive outpatient program, the IOP, that's the centerpiece of the program. It's the treatment option most preferred by our veterans. It provides customizable, results-based, and evidence-based PTSD treatment for veterans with extended assistance to optimize their chances for success. And what I mean by extended assistance is we stay in touch with them for a period after their treatment to make sure that they're integrating back into their families and their work and their lives and things like that. The IOP program, though, is just phenomenal, and the clinical outcomes associated with it demonstrate that this program is highly effective and that participation in the program leads to large reductions in PTSD symptoms, including suicidal thoughts and actions. But here's the best thing about all of this. Thanks to our generous donors, that world-class care that I just talked about is provided at zero cost to veterans and service members. Travel, lodging, and meals are also provided at no cost. And I might also add that in response to COVID-19, these great people at Emory have stood up a telemedicine option for Georgia veterans that we hope to scale nationwide. It's very effective, and we're just having to work across state boundaries to grow that out so it's available nationwide. And if you want to know more about the Emory Healthcare Veterans Program, just go to their website for all of the good news on that great program.
How long is the time frame from applying to maybe being able to start the program on average?
It depends on a number of factors. One is the caseload in front, the throughput, in other words. And it also depends on when the service member or veteran is available to attend, because some have to make arrangements to be able to do that. So
Sure.
it can
Yeah.
range from a few weeks to a few months, and across that range. Dr. Kitson, I think you or Cordelia asked earlier about how the program measures success.
Mm-hmm.
Let me just talk about that, because we're pretty proud of that. We measure success in many ways. And I'd say our North Star is ensuring that our program helps veterans do the things they want to do to have a valuable life. And success occurs as people leave the program and go on to have better relationships, improve work and home function, and things like that. The program does assess symptoms and function using many different measures, and we look for improvements as well as maintenance of gains over time. Specifically, we look at biological changes that are related to stress response and PTSD, aiming for changes that can support function. And also, I would add that we measure program success and retention of patients to completion, and we get amazing benefits. I forget the actual retention rate, but it's I think low 90s, high 80s, something like that, right about just say 90% retention rate, which is pretty stunning, because in other places it's about 50%.
Yeah.
And again, the benefits are amazing. I've seen them myself. The Emory program is saving lives every day. And last, I would say we talk with all veterans as they leave the program to see what they think of it. You know, what works, what doesn't work so well, what we might do to make the program better in the future. So our veterans are never shy in providing that kind of feedback, and we take it to heart.
What would you say, and it's hard to summarize, but the active ingredient, the core component that's allowing for the healing that's occurring? I know there's so many elements to the program, but is there anything that comes to mind for the secret sauce of allowing for growth and healing?
I think the unique nature of the intensive outpatient program, and whether that's done at Emory or one of the other 3 academic medical centers, is the fact that it is very focused. You are free of distractions you might be facing at home or at work or things like that. So you're in a very pure environment where, you know, the therapist can focus on you, and it's very intense, just like the term implies. It's all day long. You have homework at night where you're going back and reviewing your tapes, and then coming in the very next morning and talking about that with your therapist. On the weekend, we have activities lined up for the patients as well, typically taking them out into a crowd environment or an outdoor activity or something like that to allow them to deal perhaps with some of those
Triggers,
issues. Yeah, exactly. So it's two solid weeks here at Emory of pure treatment. And that the fact that there are no distractions, you're just not going to a once a month appointment, that kind of thing. It has, again, amazing outcomes. The PCL measurements that doctors track are quite remarkable.
This is a really great resource. I'm so glad that I'm going to let Cordelia ask a question, but just to be able to share with those that are viewing this webinar, just to know about, because I think it is people understand that they might be experiencing PTSD, and there's some awareness of VA programs, but really to understand that there is intensive treatment programs empirically supported that can be accessed through other avenues is really important communication to get out there. So I'm glad that we're having this opportunity to offer, a place to continue to spread the word about this. Cordelia, did you have a question for?
Yeah, I was going to ask about the family component in the program. I mean, especially tying back to the idea that PTSD, especially within veterans, is such a stigma. Sometimes those closest to them are the ones that see the symptoms first. And so anybody that's out there watching this webinar that's a family member to somebody that might be suffering, what is their component in the program? can they reach out to the program, potentially get an intake started? Or
Yeah, so we only treat post 9/11 service members and veterans actually in the program, but we do include their families in that treatment, and we do that via telemedicine. And we have found that is the most effective tool to do that, because bringing the entire family here to Atlanta, as you all know, when you travel with kids and things like that, there's a lot of drama associated with that, the logistical burden associated with that. And then the fact that your family, actually, it would take away your time that we've got you focused in the program. So what we do is we have the spouse, for example, who is essential to successful treatment. We engage that spouse in a telemedicine option if they would like to participate. It's highly effective. We get lots of very positive feedback on that. And the spouse going through the treatment here at Emory also, the feedback we get from them is very positive. So that telemedicine option with the spouses, the families, that's essential for preserving long-term gains, because we don't want to just take a veteran and push him right back into the same unchanged environment that he came out of. So again, we use telemedicine for the family option. It's been very successful, and we hope to see that continue and even grow perhaps in the future.
And
Yes,
we're wrapped.
sorry.
You go. No, Cordelia, you go.
No, it's just that was what I was going to lead into is, what is the future treatment of PTSD, as that continues to grow and, transform.
Sure. So let me make a very bold statement here. The Emory Healthcare Veterans Program has an active research effort underway to disrupt veteran mental health care, right?
Mm-hmm.
We're going to disrupt it. And the way we're going to do that is, we think, is through the use of biomarkers, blood biomarkers, which may help diagnose PTSD and then optimize the treatment option for each patient. Mm-hmm. So we can use that blood sample to understand more deeply your symptoms and the treatment option that might work best for you. And our researchers are hopeful that biomarkers can lead not only to more accurate diagnoses, but also earlier ones, perhaps indicating signs of problems even before PTSD is fully manifested. So
and if you have any research also, I'm just thinking, I'm sure viewers, and I know I'm very tempted to learn more about that. If there is a paper, anything, as we're posting this webinar, we also could, if there's any research to go along with it, we could also share for individuals that want to learn more about this, because it's very hopeful and super important.
It is, and we'll definitely have to make sure that ADAA is linked with Emory on that research, so we can make sure it's going up on your website and that kind of thing. Yeah, that's exciting. We'd love to do that.
Okay, and last question for now. I'm going to mute myself because my son just walked in. Cordelia.
Sure. Yeah. So I guess thinking about anybody out there that's watching this that might be suffering from PTSD, what advice do you have for them?
Well, Cordelia, thank you. I think even though PTSD treatments work, many people who have PTSD don't get the help they need. And I would just, whatever ADAA and other organizations can do to help us spread the word that effective PTSD treatments are available. And if you or someone you care about may be struggling with PTSD, the time to seek help is now. You shouldn't carry this burden. There's no reason for that. The treatments are highly effective and they can transform lives forever. And if you're a service member or veteran, you need to go to the Emory Healthcare Veterans Program website and check it out. It's pretty inspiring. There's some great videos there as well. And I think if you do that, you'll understand that this can be taken care of and we can get this burden off your back. You can reclaim your life and move forward.
I'm inspired already. I haven't even accessed all the resources, but this is good stuff, and we're really excited to share it. And this could be the first of a future conversation. So I know ADA and ADA members would love to learn more as well. So we'll definitely plan on staying in touch and hopefully connecting with you again soon and learning even more.
That sounds great. Thank you again, and be well, everybody.